I think something's wrong.
Oh, Timmy, what is it?
My tummy feels really full and round, and it kind of hurts.
Were you stealing the cookies from the cookie jar again?
No, I swear I wasn't. I don't want anyone to make fun of me.
Timmy, we're your parents and we love you. We'd never make fun of you.
Okay. I know I'm not supposed to wet the bed, but I keep having accidents at night. I don't mean to. I swear. I didn't want to tell you because I didn't want anyone to make fun of me.
Timmy, you should have told us sooner. Bedwetting is not a big deal, but hurting when it goes to the bathroom, well, that could be a serious problem.
Is there anything else weird going on with your body? I know it's hard to talk about, but you can tell us anything.
Well, sometimes it really hurts when I poop.
I'm glad you told us, Timmy. We should really talk to a doctor or a nurse about your symptoms and see if we should be concerned.
Did someone call for a nurse?
Oh, thank heavens.
Yes, our son, he's having some pain and issues when he uses the bathroom.
It hurts when I poop.
Okay, well, tell me a little bit more.
He's been wetting the bed more frequently, and he told us that he's been having some pain when he urinates. Also, as he clearly stated, it hurts when he poops.
Okay, Timmy, I know this might be an awkward question, but can you tell me how often you use the bathroom?
I don't know. Is there supposed to be a regular pattern?
It can vary from person to person because everyone's different, but you should ideally have a regular bowel movement pattern.
I don't think that happens with me.
Okay, well, how have you been eating?
Well, usually he's a bottomless pit, but lately he hasn't been eating as well.
Okay, I just have one more question for you. It's going to be weird, but I need you to answer it. I'm just trying to ask so I can find out what's wrong.
Like a detective?
Exactly. So, last question. When you do poop, what does it look like?
Well, sometimes it's really hard and small and chunky.
Well, thanks for answering all my questions, Timmy. Now I just have a few for your parents. Do you or your wife have any family history of GI symptoms?
Why, yes. Timmy's uncle, my brother, he has irritable bowel disease.
Okay, and has Timmy's behavior changed in any way?
Well, he has been avoiding using the bathroom. I noticed it because when he has to go, he usually starts doing this weird dance and jumping up and down. Basically, I have to force him to go to the bathroom.
Wow, these questions!
Well, I'm just trying to figure out some routine data so the doctor can make a proper assessment of Timmy so we can figure out what the problem is.
Did somebody call for a doctor? Constipation.
Gee willikers, what's constipation?
Well, constipation is a very common problem that we see in pediatrics. What happens during constipation is that there is a failure to completely evacuate the lower colon. Because of this, we commonly see kids passing hard, dry stools that can either be large or small.
Wait, how do you know he's actually suffering from this?
Well, Timmy seems to have a lot of the classic symptoms. Pain with defecation is very common, as well as an altered stool pattern. Bedwetting and recurrent UTIs are also common symptoms. From what you've told me, he also seems to be exhibiting signs of withholding behaviors. Children often try to do this to withhold stool. They cross their legs, squat, hide in a corner, and dance.
Goodness, he has been exhibiting a lot of these symptoms.
So what's the course of treatment for this sort of thing?
Well, there are a couple ways to deal with chronic functional constipation. Dietary management, which includes increasing fibers, may initially manage it. In addition, behavior management, such as teaching young Timmy here to evacuate stool when it is present. In Timmy's case, he exhibits withholding behaviors. Dietary management may not be enough and may require laxative therapy. For fecal impaction, I'm going to recommend that you use enemas and stimulation therapy when Timmy shows signs of impaction. I'm going to write down the instructions for how to administer enemas as well as laxatives and leave you with a simple dietary plan. Any questions?
Okay, well, should we go over the instructions again? All right, so the first step in dealing with constipation is recognizing the symptoms, especially since Timmy might be embarrassed to express what's going on. As the doctor noted, the signs and symptoms of constipation include abdominal pain, withholding symptoms, stool in the children's underwear, painful bowel movements as well. It's important to recognize these symptoms and then help Timmy deal with it so he doesn't result in having impactions.
I know that I have to go. It just hurts, so I don't want to.
And that's really common. Usually this problem begins with a large constipated stool and a painful bowel movement experience, and that makes you not want to go again, doesn't it?
Yeah.
And that's why you and other kids who have constipation start withholding stool and avoid using the bathroom.
So what can we do to help Timmy with this problem and help him avoid constipation?
Well, it's really important to follow the medication treatment as the doctor prescribes it. Increasing Timmy's fiber in his diet will really help a lot. With foods like vegetables, whole grains, breads, fruits, things like that is really important. And I know it's hard for kids to eat these kind of foods, so if you can buy foods like fiber-rich cereals, oatmeal, crackers, and try to use vegetables as snacks for them. I'll give you some information on how to specifically increase the fiber, but you should also make sure he's staying accurately hydrated. Water and fiber go hand in hand. Also, make sure that you correctly follow the other medication as the doctor prescribes, especially the laxatives. Administering them correctly and as prescribed is incredibly important. Both the doctor and the pharmacist will go over those instructions with you.
Okay, so with all these different approaches, Timmy's constipation should be taken care of.
I sure would like that.
Following all the instructions the doctor gave you will certainly help Timmy with this problem, but it might also be helpful to address the behavioral aspect.
Good golly gosh, behavioral aspects?
Well, constipation can be very stressful for both you and Timmy. It's important to also promote good bowel habits. It might be helpful to encourage daily bowel evacuation, like maybe having him sit on the toilet 2-3 times a day after meals for 5 to 15 minutes. And you can reward him, but not just when he has a bowel movement. Reward him for when he sits on the toilet. Helping Timmy change his bowel patterns is going to take some time.
So, these things you're telling my mom and dad, and they're gonna help me, right?
Yep, but you really need to listen closely to your mom and dad and work really hard. It probably won't be easy, and it'll take some time, but the more you do it, the better you'll feel.
Okay, I can totally do that.
Great. Do you have any other questions, Timmy?
I don't think so, but I have something to say.
Whatever that be, Timmy.
Almost went poo in school today, but the pain in my belly pushed it away. Almost played football in school, but the discomfort made me so uncool. Now I ride benches with all my friends, and I feel like I should be wearing Depends. And I almost went poo, but sometimes that doesn't cut it. Almost went poo, and I wish I would have done it too. Almost pooped at home later, so I could ride out with the skaters. I felt so nauseous I couldn't eat, so I watched my friends skate down the street. It left me home with my stained drawers while I lay in pain down on the floor. And I almost went poo, but sometimes it doesn't cut it. Almost went poo, and I wish I would have done it. It kept me all up, I'm all bound up, spend my time missing you, and I wish I would have just gone poo. There are simple changes that can help. I'll eat green vegetables and a piece of cantaloupe. Mom can give me medicine and I'll drink all my juice. If I'm puking or losing this weight, Mom will take me to the doctor with no debate. My belly swells, Mom knows it's no gimmick. She'll take me right down to the local clinic, and I almost went poo, but sometimes it doesn't cut it. Almost went poo. I wish I would have just gone. Avoid all this mess, eat right, don't stress, don't be afraid to poo. And I almost went poo. Almost went poo. I only wish I would have just gone poo.